Welcome to my workplace at Ranaghat, West Bengal, India. This is a cataract with grade 2 nuclear sclerosis. Let us observe this totally unedited surgery. The ocular surface is thoroughly irrigated with BSS, instilling few drops of povidone iodine. And now I am going to make two side ports first in this case. One at around 8 o'clock, other one at around 2 o'clock. And now I am going to make the main incision at around 11 o'clock. So the side ports are about 3 clock hours away from the main incision. When the side port is 3 clock hours away from the main incision, astigmatism induced by the main incision is neutralized to some extent by the side ports. The antechamber is filled up with visco and now Capsulorhexis. This is a Oertli forceps. We have very good red glow. The microscope is Lumera-T from JIPMER, and we have done a nice rhexis of about 5.25 millimeter. And now hydrodissection is done with PSS using a 27 gauge cannula, and the nucleus is tapped and the nucleus is rotated. The anterior chamber is filled up with visco 2% HPMC. The main wound is enlarged to about 2.9 or 3 millimeter. And now this is the Prechopper going through the main wound and the nucleus sustainer hooking the opposite equator. This Prechopper and nucleus sustainer has been designed by me in the last December, almost 1 year back. And see how beautifully we can divide the nucleus into 4 pieces in about a minute. Done. We have got 4 nice pieces. If you find that the antechamber is becoming shallow, come out, inject visco and do it again. Get 4 pieces, at least 3 pieces. And now the phaco needle goes in, some superficial cortical lens matter is used, the pieces are separated from each other, and then each nuclear fragment is held at its apex, brought at the center and emulsified. Since the nucleus is soft, ultrasonic energy used is about 30 to 40%. Flow rate is 48 ml per minute. Vacuum is 480 millimeter of mercury. In this case, I am going to use bimanual irrigation aspiration for cortical cleanup. So my assistant is getting ready with bimanual irrigation aspiration. You have to wait for about 10 to 15 seconds for this at this time. And now the irrigating probe is used to hydrate the cortex all around. And now the irrigating probe goes to the right side, aspiration from the left, and most of the cortex can be removed just by the aspirating probe remaining from one side. See, very little cortex is remaining on the left side. So here it is. Change hands and remove this cortex in a second or two. We can see the rhexis is very nice, about 5.25 millimeter. And I hope the optic of the intraocular lens will be nicely overlapped by the anterior capsular rim. Let us see. Here goes the intraocular lens hydrophilic acrylic single piece monofocal intraocular lens, and see the optic of the intraocular lens is nicely overlapped all around by the anterior capsular rim. This is a little bit of moxifloxacin, and now the side ports are closed by hydrating corneal stroma. So in this case we have cleaned the cortex by bimanual irrigation aspiration. You can use any instrument, but the cleaning should be nice. There should not be any cortex remaining anywhere, and the posterior capsule should be nicely polished. The integrity of the wounds are checked and the case is concluded. Thank you very much for your attention. Hope this video will inspire you to use the Prechopper that I have used in this case. This is known as Mohanta's Prechopper. It is available with me as well as with Zoja Surgicals. Thank you very much for your attention.